Yes, we are live. Hello, good evening. How you day? Hi, how are you? Good evening. Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. Nigerian time. How are you? My name is Dr. Frederick Unubohai. I'm a licensed medical doctor and I'm the host of this program. Now, today we'll be talking about a very interesting topic. We'll be talking about high blood pressure, the truth about high blood pressure today, so that for the people that want to know about hypertension, high blood pressure, you want to ask us any questions today, we'll be willing to respond to you. But how are you? Where are you watching me from? I am live on Facebook, I'm live on YouTube, I'm also live on my TikTok page. So we have people watching us on YouTube, we have people watching us on Facebook as well as TikTok. So how are you and where are you watching me from? Oh yeah, let's go. No time to waste. So tell me where you do watch me from, where are you watching me from? And luckily my co-host is around tonight. Dr. Israel is currently on ground. Dr. Israel, if you're ready to come up, just give me thumbs up. Dr. Israel, good evening. How you day?
Good evening. Happy Sunday.
Yes, happy Sunday to you. I can hear you loud and clear. Welcome. So we just started. I never even go far at all. I never even do anything. So now this evening, a lot of people don't hear about high blood pressure, hypertension. So before we start, I want to make the over how many people now? Close to 50 people where they watch us on YouTube, Facebook, and TikTok. Tell us in the comment section, what do you understand by high blood pressure? Oh yeah, tell us.
And
Before we
I'm
start.
not sure saying I just sorry. I'm not sure saying I just wait till they understand by high blood pressure. Wait till they don't hear about high blood
Mm,
pressure. And wait till they don't hear about high blood pressure.
oh yeah, tell us. Wait till you don't hear. I can see Shy Boy here. Good evening. I can see Andrew here. Andrew, good evening. Eula Stella on YouTube. Stella, how are you? Good evening from Cameroon. So, waiting you don't hear about high blood pressure. Waiting there your mind. Break them. Tell us. I dey wait for you. Oh yeah, tell me on TikTok, on YouTube, on Facebook. Oh yeah, oh, fire down. Let us know. We are waiting. We want to hear from you. Huh? Make we know before we start to fire down. Before. Hey, yeah, quickly. Let me see your comments. If you dey here, oh yeah, tell us wetin you don hear about high blood pressure. Wetin dey your mind whenever you come across this word. Oh yeah, tell us. I can see some of our people on TikTok. One of our chiefs, so Dr. Israel. May we break them down because these people,
Yeah.
be like say they dey shame. They dey shame to talk to us. So may we start because of time. May we just break them down. Wetin be high blood pressure? But before we talk about high blood pressure, e go good make everybody wey dey lis ten to us, you understand say as long as you dey alive, as long as you dey breathe in and out, you get blood pressure. If you no get blood pressure, you don kpai. If you no get, you don kpai, you no be human being. So every human being get blood pressure. But the problem be say this blood pressure, if e go up, if e go high, the blood pressure, if e go down. But for today, we want to talk about that blood pressure wey go high. So when your heart beats, you go carry blood around your body. As the blood dey move, the blood go get power inside your blood pressure. But e get some cases, the blood pressure as e dey move for your body, e go come go up. Later, e fit come down. E go go high, e go come down. But for some people, e go just go high, go come stay like that. We go talk say, right now, you have a high blood pressure. You dey hear me so? So make I allow Dr. Israel, make e continue. Somebody says, I don't know anything about high blood pressure. Oh. Now why I dey here be this? Oh yeah, now. Somebody says, who be this? He say high blood pressure na abnormal flow of blood where the heart need to pump blood using more force than usual. Dr. Israel, over to you.
Okay. High blood pressure now the same thing as hypertension. And we they call hypertension. So we go call am we go call am hypertension. Yeah. So what will be high blood pressure? Just as the name talk, it means say the pressure of how the blood take dey flow e high, e high pass normal. So it means say
Mm,
there's a normal blood pressure, that is the normal pressure when the blood take dey pass through the blood vessels. So when we dey talk about blood vessels, we dey talk about the artery and the veins, all those places where our blood dey pass through. And dey pass till dey go every part of the body, from the heart to every part of the body and back to the heart. So if that pressure, that movement when e dey pass high, we go come call am high blood pressure. So that is that and the simple definition of high blood pressure. So high blood pressure, as I said, now when the pressure, when the blood take dey pass through the blood vessel dey high and
mm,
higher than normal, then we
mm,
go come say this na high blood pressure. And there are so many things wey fit cause this high blood pressure. So before we enter the enter things wey fit cause am, I just say make you, as Dr. Fred first talk, I just also want you to know, say yes, when person come tell you say you get blood, you get BP, everybody get BP, that is blood pressure. So now when e come high now or very low, then it become a problem, it becomes a problem. And we dey call am silent killer. High blood pressure na another thing wey we dey call silent killer. The reason why we dey call am silent killer is because people fit just dey with am for a very long time and dem no go show any sign. The body go dey try and dem no go show any sign until one day, and that one day fit be say na im be the last day. E fit just still be say na that day na im be the last day. That's why we dey call am silent killer. E dey easy to manage if we really understand am and we dey follow the right things to do. E dey
mm,
easy to manage. Just that because e no dey quick show for face, most people no dey even believe say dem get high blood pressure. Most people no dey quick believe. And now
mm,
we no really get one particular blood test wey dem say you wan go do, you come pay big money. You know
mm,
the most funny thing is that high blood pressure, to check for high blood pressure is one of the cheapest thing to way to check for am. Just for you to simply go check your blood pressure. And you can
yes.
check your blood pressure for hospital. In fact, that's the first thing when nurses dey do for patient, and we dey call that, is part of our vital signs. So
Mm,
when we say vital, when we use the word vital, vital means say this thing dey very, very important.
important.
It means say to check your blood pressure dey very, very important. Because you no get one blood test wey you go drop blood, go check for lab, come say, oh, as I check this blood test, e mean say this person na hypertension. No, na just go check your blood pressure. Go check your blood pressure. So with this, still dey use that dey tell you, so it is very important that you check your blood pressure at least once a month. Nothing go kill you, nothing go beat you if you check your blood pressure at least once a month. Dr. Fred.
Dr. Israel, thank you very much. You don't talk a lot of things. If you just dey come, we dey talk about high blood pressure tonight. High blood pressure. And a lot of people go tell you say dem say I get BP. No, you no get BP. You get high BP. E can affect anybody. Before we go dey think say na only people wey don old, only people na only papa mama wey don old fit get am. E can affect anybody. Young person fit get am. People fit just come hospital. Somebody come meet me some time ago, he say doctor I dey get, my hand dey pain me, and as a standard for all medical professional, we go check your vitals. Na im I say make we check the vitals first. Lo and behold, this person BP e be like emergency. Now I say, Oga, this your hand where they paying you, you know, concern me again. This one, no, you know, they important. Waiting they important are this your BP. Because this your high BP, if we not do anything about them, if you just the waka for road, if you just get stroke. And a lot of people they carry and waka, they no know say e dey their body. That is why we dey call am the silent killer. E go just dey your body, e go dey chop you, dey chop you, dey chop you. One day, e don scatter the person body. Now, because of time, and I know say a lot of people get questions for us on this topic. By the way, shout out to Dr. Snoweezy. We have a very senior doctor too on TikTok. He dey watch us right now. We also have one of our very good colleague, friend, and brother, Dr. Blessing Arimie. He's also on the live session on TikTok. And so we get many doctors where they listen to us right now. Licensed medical doctors. No be doctor, we go still title. We are licensed. Now, wetin can be the value of the blood pressure? How you go take no? Because some people go check their blood pressure. Next thing they go they shout, hey, they say my BPI, BPI. How do you know? The blood pressure now always two numbers. Two. I will allow Dr. Israel continue, but now always two numbers. Listen to me, two numbers. So when you check your blood pressure, and I ask you, what is your blood pressure? You say my blood pressure now 100. What is 100? No, blood pressure now always two number, one above and one below. One go dey up, one go dey down. I go allow Dr. Israel continue because I wan just talk small before because he's ready to answer. The one wey dey up, forget medical name. The one wey dey up, anytime your heart do B, anytime your heart do B, na that one for up. Anytime your heart quiet wey you no hear B, that one wey e quiet na the one for down. So the one above is called systolic, the one below is called diastolic. Anytime the heart contract, e push blood, na the one for up. Anytime the heart quiet, na the one for down. And some people, as their heart dey push blood gbi, na so the one for up dey high, the one for down dey high. So what are the value? Wetin be the, so may I just allow Dr. Israel, may he continue again, and then we go just dey take so many questions. Dr. Israel, please, over to you.
Okay, and the value for blood for the normal blood pressure. So this one will also make me also give us another definition when we talk about high blood pressure. Yeah, based on the value and based on the value. So the normal value is recently the normal value is 110/70. Some even they say 170 sef. But traditionally, I dey always dey like leave am for that traditional value, which is 120/80. I just like am for there. But if your blood pressure is even less than that, 170, is normal. So blood pressure that is equals to or greater than 140 systolic over 90 diastolic is hypertension. So remember say Dr. Fred say the blood pressure value is always two numbers, one on top and one below. The upper one most of the time is always the high, they always big pass the one wey dey down. So
Mm,
once the upper one be one equals to or greater than 140 and the lower one is equals to or greater than 90, that person
mm,
don get high blood pressure, and that na high blood pressure. However, this one na the catch. Before you fit talk say this person get high blood pressure, this person
mm,
must don measure this im BP at least two times
mm,
within 6 hours or within 2 days. Like you measure am today, you dey see 140/90. You measure am tomorrow again, you still dey see 140/90. Then you can now say this person get hypertension. Because we know say there are so many things wey fit make some person BP go up at that
mhm,
instant. At that instant. Na im make we no dey just use only one measurement take
mm,
say this person get BP. Also, make I still talk this one. But if that BP you measure once is very high, like 180/110, 200/one something, whether na once you measure am You, in fact, you no even need to measure am two times. As far you measure am once, that person, we go still classify that person, say that person don already get high blood pressure because the value too high. But if the value not too
Mm,
high, like as I talk, 140/90, you go wan measure am like two times, um two times to be sure. And mostly if na that one be the first time when the person dey get that 140/90. Na im make most of the time when you go hospital, you measure your BP and e dey like that, the doctor go ask you, they don first tell you this thing before? You don first
mm,
measure your BP anywhere, your doctor come, they come tell you say the BP high? If you say
mm,
no, sometimes you tell you say okay, by tomorrow re-measure the BP. Is
mm.
because as that your one time when you take say 140/90, e no go fit just tell you say you get high BP until you measure am the second time 6 hours apart or by the next day, then we fit come tell you say you get high blood pressure. So the normal blood pressure, as I said, traditionally 120/80. When you say high blood pressure, equals to or greater than 140/90, you go say that person don get high blood pressure. Dr. Fred.
Okay, thank you. Now we get a lot of comments, a lot of comments. People they watch us, plenty people they watch on Facebook, plenty on TikTok, plenty on YouTube. Before we continue, I want you to do me one favor, do us one favor. Share this video. Oh yeah, share them. You where they watch, you share, share, share. Quickly share this video so that more people go learn. Remember, we don't tell you say high blood pressure. Sorry, blood pressure now two numbers. Two, one above and one below. We don't tell you say a lot of people their blood pressure they high and they no know. Then they waka up and down. We also tell you say some people when their blood pressure they very high, one day if you just spoil their body, the only time when they feel no safe now when it don't destroy one part of their body. And we also tell you, say if it affect anybody, whether you be old man, whether you be old woman, whether you be young bobo, abi you be young or baby. Say you are young, I mean very young, forget less than 30, less than 20. Yes, you fit get high blood pressure. So those olden days when people go talk say, abeg o, I never old o, oh baby, you dey whine me. Now let's talk about wetin dey cause high blood pressure. Don't worry, we go take your questions. We get Dr. Temitokpe is also in the house. Dr. T on TikTok, I greet you specially. I see you and I greet you. Welcome. We get so many doctors where they watch us this evening, and we salute you. Now, wetin dey cause high blood pressure? Why be say I go just dey? Next thing, my BP don high. Doctor, na village people cause am? Doctor, abi na somebody wey I no greet na im come throw me arrow? No, 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 no be am. I'm going to start again and I'm going to try to be very fast because of time so that we fit take a lot of questions. The very first one be say most of the time you no go know wetin dey cause am. No, you no go know wetin dey cause am because for medicine, e get many things wey doctors, scientists dey research. But this one, they say plenty. We go check, 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 check. Nothing dey cause your own. You go come dey think about your life whether you don go offend one old man for your village. No, not like that. So most of the time you have no known cause. We dey call am primary. But in some other cases, e get wetin fit cause am. Many people own you no go fit find. But some other cases, few cases, you go come see say na this one o, na this one o, na im cause the high blood pressure. So I'm gonna open again to allow Dr. Israel continue sharply, sharply. And then when we now come back, we'll come take two questions. Then we will continue again. We'll take two questions, we'll continue again. So Dr. Israel, sharply, we'll just break them down.
Okay, and yeah, most of the time there's no known cause for high blood pressure. So what do we really get now? What do they call risk factors? And we they call them risk factors. So when we say risk
Mm,
factors, we say risk factors, those are things when go predispose somebody, make that person can't get a particular disease. And the disease a particular condition. And the condition we they talk about today now high blood pressure. So The risk factors, because high blood pressure na chronic disease, the risk factor most of the time we divide am into two. We get wetin we dey call the modifiable and non-modifiable risk factors. No more than not mind me, all dis one na just big English. So the one we say modifiable, we mean say those things wey you go fit change. So if you change them, your BP likely will come down. Then non-modifiable, those things wey you no go fit change, they are there, they are there. There's nothing you can do about it. And one of them na age. You cannot change your age. Your age will always go up. So age, the study show say it's more in elderly than young people, but e no mean say e no go fit affect young person. Just as Dr. Fred dey talk since, e no get any age barrier, e can affect anybody. But it's commoner in older people. But it can affect every age group. Another one na family history. So study still show say if your family, person for your family get high blood pressure, there's every tendency say you fit still come down with high blood pressure. But e no just mean say na everybody wey get their family get high blood pressure, e no mean say all of them must come down with high blood pressure. It's not a compulsory fact. Then the geographical area still contribute. Then when we talk about the modifiable risk factors, we come dey talk about your lifestyle.
Mm,
Those wey dey live sedentary lifestyle, dey eat fatty diet, dey eat things wey contain a lot of fatty food, wey come build a lot of cholesterol for their bloodstream. Then dat na one. Those wey no dey do exercise, those wey dey smoke, dey drink alcohol, those wey yeah, okay. E get one wey bin enter my head, e just fly comot now. E just fly comot now. Yeah, those wey dey eat a lot of salty diets, food wey contain a lot of salt. No be just there are some people wey be say dey go cook for you finish. After dem cook for you finish, you go come still go carry table salt come dey add am join the food say the salt no reach. So those kind of persons, they are prone to come down with high blood pressure. You can see say I don mention some few things wey we fit modify. People wey no
mm,
dey do exercise, if you start exercise, there's every tendency say your blood pressure go come down. People wey dey eat a lot of salty diet and spicy food, if you reduce am, things can change. People wey dey smoke, wey dey drink alcohol, no be just drink water o, drink alcohol. Yeah, so those people are also at risk of coming down with high blood pressure. Yeah, so I don talk about sedentary lifestyle. You no dey do anything, you just dey, you want to eat all the food, all the fatty food, all the junks in this world. Na
mm.
your hands dem for dey see am. So e just be say you dey cause problem for yourself. So those junky food, a lot of fatty things, a lot of fat dey wey go all of dem come go stay your blood vessels, go come dey cause wetin we dey call atherosclerosis, and that one go come make sure say the blood vessel come dey very tiny, wey be say the blood go come dey use force take dey pass, and that na also one thing wey dey cause high blood pressure. So if we fit change all those our lifestyle, fit change all those things, and there are some medication that can also increase your blood pressure. If you fit
Mm.
change all those things, then most likely most persons will actually come down, will actually not get high blood pressure later. Now there's still a kind of high blood pressure wey fit affect a set of persons, and these are pregnant women. We dey call this high blood pressure pregnancy induced hypertension. Pregnancy
Okay.
induced hypertension. This one na only when the person get belle na im dey get BP. E mean say na pregnancy na im cause that BP. But some persons, after dem don pass that pregnancy, some of dem, the BP go just continue. This one na because they may have some underlying factors, some underlying issues, maybe family history and other stuff wey fit make dem wey fit give dem that wey fit make dem come down with high blood pressure. So na im dey make dem dey come down with high blood pressure. Dr. Fred.
Dr. Israel, thank you very much. Now, we have a lot of people watching us. We have over 200 and something people watching. Now, if now your first time where you dey listen to us be this, number one, we be licensed medical doctors. Number two, we don dey do this program for more than 5 years. Every Sunday, more than 5 years, every Sunday. Maybe we never come throughout 5 years, maybe twice. But for the past 5 years, we dey here. So no be say we just stumble into the program. We have been here before the page grow like this. So you are welcome. There are some things we don't do here. We not go give you medicine on this platform. So in case you dey listen and thinking that we go start to dey share medicine for you, you are the wrong place. Our license is the most precious thing to us. So we no go throw away the license because of you. But we go advise you. We go tell you wetin you go do, whether you go need to see your doctor. We go explain to you. You dey hear me so? Number two, we no go give you our phone numbers. We no be like those people wey dey find people, wey dey find patients. No, we are not here for that. We are only here to teach you, educate you with evidence-based information, and then we disappear. I have to say this for you wey dey watch us for the very first time. Are you okay? Now, may we continue. May we take one question. Yeah, somebody says the last man, yes, stress induced. Okay, yeah. Stress induced, drug induced. Some people also get kidney problem. Their kidney problem fit also push their blood pressure. Some people fit get hormonal issues. Hormonal issues also fit push their blood pressure go up. So there are many things apart from the other ones, the few ones wey we don mention to you. Now, let's take one question. And then we'll continue again. Make I check one question for Facebook. Make I check one question. May I see whether we fit take one question here this evening on this topic. Let me see. I dey check. And I no see your question. Oh. Okay. Um, wait. I dey come. I want to take one question on Facebook or YouTube first. Let me see. I dey check. Abeg. Uh-huh. Okay, good. See this question here from Simon. He said, abeg, doctor, my question be say, shey na everybody go fit get high blood pressure? Abi na only adults go get? Shey na everybody wey dey lis ten go get am? Abi na some people? So, Dr. Israel, make we. Okay, yeah, I see that. I see it. Okay.
Okay. o- okay, as we talk, everybody can come down with high blood pressure if you not follow, if you not do the right things. And mostly if you get all those predisposing factors, you get all those factors wey fit make you come down with high blood pressure, you can come down with high blood pressure. We don see children wey get high blood pressure. This one not because some of them are because of other conditions when they get. You hear Dr. Fred talk say if some people get kidney problem, they can come, their BP can come up, yeah, which is true. So some of these children, when they get some kidney issues, get kidney problem, sometimes their BP will shoot up, and it means that they get high blood pressure. So it not get age related. It not get anybody wey no fit come down with high blood pressure. But as I said, if you wan take statistics or for everybody wey get high blood pressure, it's mainly among the elderly than the young ones. But most of the time recently now, because of things wey young people don dey do, and cream and all those things wey we dey rub for body and drink and take, most young persons now, even between the age of 30 something, most of them don still dey come down with high blood pressure. So e no get any age limit. Anybody can actually get high blood pressure.
Anybody fit get. Now we dey work with time. The questions are pouring in. Wahala. Okay, may we go very fast. Let's talk about the symptom. How you go fit take know say your blood pressure is high? Is there any way as a man, as a woman, you go just sit down and then your body go give you sign? You go just see and say, now my BP is high. The answer is no. Na make we dey call am silent kpai. E dey kpai people silently. E go dey inside the person body. E no go even give am any sign at all. Even you wey dey watch me right now, your BP, that is your blood pressure, might be very high and you go feel okay. But you are not aware that that blood pressure wey high, e don dey give you problem. By the time you start to notice headache, because somebody don put headache now, she no know say she fail am. She fail am. Yes, this lady don fail am. By the time you start to dey feel headache because of high blood pressure, e don dey spoil your body small small. At least e don dey cause small small damage. So you are not supposed to wait make you dey feel any sign say your BP high. So the first symptom is no symptom, silent killer. But for some other cases, other people body, you might now start feeling some kind complaint. The very common one, you fit dey feel headache. Your head go dey do you gbig 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 gbig. You don drink all the paracetamol, you don drink all everything, your head still be like dey dey pound yam on top. Now remember, you are not supposed to be feeling any sign, because when you wait to dey feel sign, e don dey scatter the person body. Some other people fit dey even get chest pain. They fit dey get my chest dey pain me. Why? Your heart is working too much. Your heart dey e dey work. You don dey give am too much work and you no know. Some other people fit dey even feel dizziness and many other symptoms. Now let me allow Dr. Israel again, make I allow am again, but listen carefully. Let me say this, because we get so many I too know dey social media. And what do I mean by that? The moment you start to feel headache, everybody go tell you now say na your high blood pressure cause am, not knowing that even eye problem can give you headache. Eye problem can give you headache. You no even know say problem inside your blood can give you headache. Now, because we mention headache here and you dey get headache, we no talk say you have high blood pressure, or because you dey get weakness, chest pain, we no talk say you get high blood, because a lot of you get I too know for your body. Body dey catch you well well. No, we didn't say that. Abeg, if you know say you dey get headache well well, you dey get chest pain, you dey get dizziness and other symptoms, I beg you in the name of God, enter hospital. If you sit down for internet and you kpai, na you we go blame. Dr. Israel, over to you.
Okay, I think wetin Dr. Fred just talk, those are just mainly most of the symptoms, because every other symptoms wey person go notice na other diseases wey either the high blood pressure don cause, so dem come dey feel some of all those symptoms, or maybe na the problem na im don cause the high blood pressure. Yeah, so when you don dey get headache, e mean say the next thing wey person fit come get na stroke. Because this BP, high BP, it can cause a lot of things. It can cause a lot of things. And all those things now people come dey bring come out as symptoms. So those are some of the things when we go see, we say, oh, e be like say na high blood pressure don dey cause this one for this person body. So some persons fit present as stroke patient. They just fall, they get convulsion. They say they get convulsion. They just fall for ground. One part of their mouth go just bend,
Hmm.
their hand go weak, one of their hand and their leg go weak. Sometimes they go just sit down, they no fit talk. They want talk, but they no fit talk. Transient ischemic attack. They just dey there, they no fit talk, but they feel like talking, they feel like saying something, but they could not say anything. So some persons can present like that. Another thing na say for men, they fit not dey, they fit not dey, their this thing fit not stand again. Their odogun fit not stand again. And it's a problem. Then some of them go dey get cough. If you don dey get the cough, you don dey waka, you dey feel tired. Any small thing you do, you don dey feel tired. You know say, and you dey get chest pain and you no come dey breathe well. You no know say the BP don dey affect your heart. So those kind of people go fit dey come down with heart failure. Any kind of heart failure, whether na left-sided heart failure or right-sided heart failure or congestive cardiac failure. That is CCF. Some fit don dey come down with heart failure. Some of them fit even dey come down with kidney failure. They come know even the heart failure, all of them, they come notice say their leg dey swell, face dey swell. All those things, water don dey build for all part of their body. So when you don dey notice all these things, just know is a likelihood say this person get high blood pressure, and not be the high blood pressure actually make all those things. Na the problem wey the high blood pressure don give the person, na the symptom of all those things na the person come dey exhibit. Dr. Fred.
Yes, thank you so much, Dr. Israel. This topic, a lot of people they enjoy them, they plenty, but they're not a share. Now we get some questions. So make I go to TikTok. May I just take one question from TikTok, and then we will continue again because the questions are pouring in. Somebody they ask us here. He says, "I beg, high blood pressure, high blood pressure. Listen carefully, not BP. If you ask us, BP fit cause this problem, we no go answer you, but rather high blood pressure, high BP. No ask us BP because every human being gets BP. You understand? So Jane on TikTok, they ask us, abeg, high blood pressure fit comot belle? E fit make woman lose her pregnancy? So let me give you answer. Maybe you no join us from the beginning. We mention something that a woman wey get belle fit get high blood pressure. Dis woman, she get belle, and den as she carry belle she fine oo, but inside her pregnancy she come notice say BP high. As e high, e fit affect the woman, e fit affect the belle wey she get. If you no do anything, it can affect the woman badly badly. As in, if care is not taken, the BP high, e can kpai the woman. If care is not taken, you no do anything, e can even make the woman and the pikin kpai. E can make the woman lose belle, that pikin fit comot. And that is why when you get belle as a woman, we dey always beg you, say register for antenatal so that they go monitor you and your belle. They go find out whether your high blood pressure e don dey before you carry the belle, or na inside this belle na e start, and then they go come dey help you, dey manage you, dey manage you. Some women no go go. Na the time wey the high blood pressure e don come cause serious problem for the woman. E fit make the woman come dey get convulsion, wetin we dey call seizure. You understand? We're just trying to break it down for you to understand. And if you no do anything, the woman fit kpai. If you follow news carefully, you go notice say e get some cases wey be say we see wey one woman kpai like that, and we no want am. So it's possible that the high blood pressure fit affect that woman the wey carry the belle. E fit affect the belle, e fit affect the two of them. Is that okay? Shey you get abi? Now, wetin go happen? Or how do we now know say somebody get high blood pressure? How can we know? There is no way you go fit know. Whether you be man, woman, there is no way say you go just sit down now and know that your blood pressure is high. The only way you fit know say your blood pressure is high above normal na when you go check. When you go check, and when you go check, they go tell you make you sit down, say make you rest. Then they will come say make you put your hand on top something. They will come tie the machine for your hand. They will come say make you quiet, make you no talk. Not be say you go dey waka up and down, you go sit down after you don rest. They will come check your blood pressure. They will check you. Sometimes they go check you again. When we come see am say e normal, no need to fear. Bye bye. If e high, na that time we go come say oya wait, make we check you again, or we go come dey find many things depending on the level. So the only way you can know if your blood pressure is high na when you do wetin? When you check am. So if you no check, you wey dey look me, if you no check, you can never know. You can never know. You dey hear me so? And I want you to make sure you check. Dr. Israel, may we continue by what are the complications, talk about this, how to help people wey their own just dey high small. You understand? And then we take questions.
Okay. I think most of the thing, the complication can be from head go reach toe. So anything when you think about can even be part of the complication, apart from malaria. Eh? So every other thing can just be the part a part of the complication. From the head, the person fit get rupture vessels, and the blood go enter the brain. So the person fit get stroke, headache, all those stroke. E fit affect the eye. The person fit even blind because of that. eh, because of high blood pressure. So if it affect the brain, it can affect the eyes. Eh? So more can go the heart. If it affect the heart, it can cause some person to get cardiac uh, uh, congestive cardiac failure, heart failure. Eh? That stroke when e affect the brain fit affect the hand and leg. E come mean say the person no go fit waka very well. So e affect the movement, the physiology of the person is affected. The mouth fit bend. All those one
Mm.
na just stroke na dey cause, na contribute to cause all those ones when I mention. So I don talk about the heart. That I say e fit affect the kidney. E go come lead to kidney failure. For men, e fit affect their performance, say dem no go fit perform very well again. We don already talk say if the person get stroke, e fit affect their movement so dem no go fit waka. um Pregnancy e fit make dem lost their pregnancy. To Madam Eunice Ade Damilola, I'm very sorry for the loss of your 7 months old baby due to preeclampsia, and na BP na lead to that. um so blood pressure high blood pressure can actually cause a lot of things. It fit make some people legs swell. E fit cause problem to the ex ten t say you be like say something dey chook you for body small small, like say needle dey chook you. So make we no wait to get any symptom before we start to dey manage our high blood pressure. So when we talk about the management of high blood pressure, the management fit be is of two ways. We get the pharmacological and the non-pharmacological. When we talk about pharmacological, we talk about medications. And I no go tell you anything about that. I expect you make you go hospital, make you meet your doctor. Na your doctor go look at you, know the one wey e go give you,
Mm.
and e go dey follow you up.
Mm.
Only the thing wey I go talk about the pharmacological part na be say one dem no dey stop high blood pressure no get cure. So no be wetin you go start medication, say you don start the medication, you go stop the medication by tomorrow. No, no be im. Na something wey you go continue to dey take your medication and dey go for checkup. Na your
Mm.
doctor go check you, depending on how e take check you, come see your blood pressure at that period, na im go make am know whether e go tell you to reduce the dose of the drug or to stop it, or to dey take the drug alternate days. So there's no way when you just by yourself, look yourself, just by yourself stop your medication. And this na wetin most persons dey do, which is very very wrong. Den
Mm.
the non-pharmacological part na be what are those things wey you fit do to help yourself when you know say your BP don high, as even though you dey take the medication. Some other things, so because sometimes you fit dey take the medication and you still dey say this BP no dey come down, this BP no dey come down. You no know say you just get some other things wey you need to do. One, if you are very stressed, try cut down stress. Cut down stress. It is very important you cut down your stress. I know say the country wey we dey, you go say now this country person fit cut down stress. Find way. There are always ways to cut down stress. Two, exercise. Exercise is very important. Now, another thing wey I wan tell us about exercise, some persons go say na I dey work, I dey waka from here dey go work every morning, I dey do this, I dey do that, all the work wey I dey do. There's difference between exercise and work wey you dey do, or trek when you dey trek dey go work. All those trek when you go waka reach one place, you go greet 10 people for road. All those are not exercise. Exercise is a deliberate activity, something wey you do
Mm.
decide say you wan do. And na the same step when you take start am, na you go take end am. Dem no dey break for road in terms of exercise. Even when you wan greet person, you go still dey on that same step, that
Mm.
movement. Then you go dey believe say yes, your waka to work na exercise. I no go dey do exercise for under sun, that na suffer, that na punishment. That one no be exercise. Dr. Fred, why you dey laugh? If you dey drink, Dr. Fred, stop. Let me
No
talk.
vex.
If you dey drink, it is better. If you dey take alcohol, it is better that you stop taking alcohol. It is better, but we dey always dey say reduce am, but it is good you stop alcohol, because now studies have shown that alcohol can even cause some serious other things. So because of that, it is good you stop alcohol. Smoking, you stop am. Very very important. Very very important. So if you need to do test, come check of other things. If you see other issues for body, wetin you need to do na to go treat dem. If na hormonal issue, you follow your doctor talk, e go manage am for you, den you go come back. If na cholesterol high, e go manage am for you. Even exercise, the kind of food you eat will still help you. If you be person wey dey eat a lot of salty and spicy food, you need to cut down all those salty and spicy food. If you cut dem down, it will also help you. Fatty diet, you need to reduce it as well. So when you are able to do all dis, eat a lot of vegetable, eat a lot of fruit, take good water. When you do all dis, you fit just help yourself reduce or stop hypertension. Dr. Fred.
Thank you so much, Dr. Israel. Now, before we continue, I want to do a small break, advert break. This is my personal. We never get any sponsor. So for those wey dey into content creation, I want you to get my course. The reason I dey talk this every time we come online, a lot of people dey damage their page by themselves. Some people don spoil their own page today. I dey tell you because I know. They don spoil their page, whether na on Facebook or on TikTok. So if you know say you no wan suffer, you want proper guidance, you want somebody to help you, get my course on content creation. E go help you. You no go regret. Na me do am. And after you watch am finish, you go come back and tell me thank you. So look at the email on the screen, send an email, my admin, my PA, e go tell you how much to pay. It's very cheap, 10,000 naira. You go watch and you go tire. You go learn a lot of things. This one is the advert inside this program. E clear abi e no clear? Now, let us continue. Somebody tell me for TikTok, e say she dey always know, wetin be her name? E say if my BP high, I always know. Abeg, madam, you are not supposed to wait for the BP to give you sign. You see how we dey take our time beg you online? As we dey beg you here, as we dey give you this information, e look like we no get work. Na lie o. Hospital full o. As much as possible, we want to reduce the number. Hospital full o. The work too much for doctors and nurses. So we are trying to reduce that number. That is why we are giving you this information. You are not supposed to wait. Make the BP dey even give you sign. Say anytime my ear, my brain dey pull me, dey draw me, my BP. No, 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 it's very bad. You dey hear me so? So let's see how many questions we fit take. Because time don go. Now, Dr. Israel mentioned something about the complication. If you no treat your high blood pressure, what can happen to you? E talk am. E talk wetin you fit do if your BP high. E give you advice. Now, wetin me I wan tell you, abeg, there is no tea. There is no high blood pressure tea. There is no high blood pressure tea. I talk am 3 times. Wey go tell you say if you drink this tea, e go cure your high blood pressure. Your high blood pressure go disappear kpatakpata. Number one, those people na thieves dem be. Dem go chop you, dem go collect your money, and that their tea go destroy your organs because their tea, nobody produce am. They just sit down for their house, do am by themselves. Those people, you no fit hold them. They just wake up, carry market, dey sell. So they don't care about you. That tea no go work. You dey hear me so? So please, there is no high blood pressure tea. Now we get some questions here. Okay, the question says, can overthinking cause high blood pressure? Can overthinking? So when we start talking about high blood pressure, we mentioned some of the causes, some of the risk factors, some of the things that can lead you to develop high blood pressure. And we mentioned stress-induced hypertension. In this particular case, this stress na chronic one. E don tey, no be stress of exam because say you go work, go do interview, you come back. No. Chronic stress. So anything wey go give you continuous, persistent chronic stress, and this stress go release hormones for your body. Those hormones, if dem continue, na dem fit push your blood pressure high. But if I just dey, I dey think of money now, maybe I wan buy land for Lekki, I wan buy house, I con dey think, dat thinking no go give me high blood pressure. If maybe my phone, maybe somebody collect my phone, I con dey think God, dat thinking no go give me high blood pressure. But if I dey work for company, dem dey use me anyhow, I dey trek up and down, I no dey sleep, all of dem gather together, I con sit down dey think, I no dey fit sleep dey think, combined together, all dis things fit push your blood pressure up. You dey see am? But no be say because you just sit down dey think now your BP goes up. No, it has to be a long while, it has to be sustained. You dey follow me, abi? Because I have heard dis question most times say, I dey think na my thinking cause high blood pressure, and there is no way to measure your thinking. There is no way to measure it. E clear? Did I break it down? I no know if Dr. Israel wan answer anything on that again. Please, let's know. We have more questions.
No, no. So we can answer other questions.
Okay, now we have one more question on TikTok, then we go to Facebook and YouTube. It says, between waiting, high and low blood pressure. May I allow Dr. Israel respond? Between high and low blood pressure, which one worse pass?
I know the for me, I know they like this particular question is question that I don't really they like to the answer. The reason because why must you wait for you to get high blood pressure, or why must you wait for you to get low blood pressure to find out which one was pass?
Hmm.
So it's
Yeah.
the two not good.
Yeah.
The two not good. The two can
Yeah.
kill somebody. So
Yeah.
don't there's no need trying to look for which
Yeah.
one good pass or which one not good pass. So that you say some people what you made that they ask this question is that when their BP come high, they'll say after all, yeah, if na low now I for don die. So the two can kill, the two not good. So no, there's no one worse pass anyone. The two are not good. So no, it's better your BP is within the normal range. It's better. And the low blood pressure, the way people measure low blood pressure is different. Your low blood pressure for Mr. A may be different from low blood pressure for Mr. B.
Hmm.
You dey get am? Some persons blood pressure is 90/60 and it's normal to them. While to
Hmm.
some persons, if their blood pressure is 90/60, it's low blood pressure and it can be a problem to them. So
Yeah.
make we not look for which one worse pass. The two not good. Just make sure that your BP is within your normal range and you'll be fine.
Okay, now our time is almost up. If you dey watch, a lot of people dey watch us on YouTube, on Facebook, and they no dey share. Now that one be the problem. E be like these people just dey look us. Maybe they no wan support. How you go dey watch, you no go share now? Why? Oh yeah, share. We have one question here. He say, I don't know what to do with this BP. We don't tell you, no be BP, madam. It's high blood pressure. I was placed on medication, but it's making my BP to be low. Please, what should I do? Your name is what? Okay, Dr. Israel, continue. Yeah.
Okay, this is what I just talked about. And this is why I tell you, say, I don't want even which one was pass, not concern me. Something like this. So, how can this person say e BP dey low? What can he say that
Yeah.
is the I don't know as I want to talk am. You go measure the BP, you see say e dey 90/60. Why do you think it is low? Wetin dey happen to you for you to even believe say that BP is low? What
Mm,
are you feeling? It is when you dey feel some things, you dey feel dizziness, you dey sweat, you feel like fainting and all those things, and you check your BP is low because of the medication. That's when you can be saying that the BP dey. Also, if you take medication and you see say your BP, all those things when I mentioned don dey worry you, mean say your BP low, you will go back to the hospital. They go review your medication. And you know when I talk about the medication part, I thought say you go hospital, your doctor go review your medication. He go know when, he go know how you come dey tell you make you dey take your BP medication. So when you say your BP dey low, you go back to the hospital, not be chemist, not be pharmacy. Because that na still another problem. Most people go to pharmacy, go to chemist, and they check their BP there, they say yeah, they'll just give them medicine and they start taking. You no know say that's not just the way to manage your high blood pressure. You need to go to the hospital. You need to go to hospital, see the expert. So that there are some investigation wey dem fit even tell you make you dey do, make you do to monitor some other organs for your body when this BP, when this high blood pressure fit quick affect. So madam, if you think or oga, if you think say your blood pressure is low, please go to the hospital. If na the medication dey cause am, let the doctor look at the medication, see if there's any reason to reduce the doses of the medication you are taking, or if it's to tell you to stop it or change you to another medication, e go let you know. So you cannot just say your blood pressure is low if you are not having some symptoms. Yes, your BP can be 90/60, but if you are not having any symptom, you are not having problem, nothing, my dear, your blood pressure not low, your blood pressure just dey normal.
Thank you. We have a lot of questions here on Facebook, on YouTube, on TikTok. Let me see if I can take one more on Facebook because we don't take a lot, a lot. Okay, see one comment here. Oh, we even have a Dr. Matthews here. Some then go tell them to stop the medication, say the BP day low. Now, this one is very important. If your doctor give you medicine for high blood pressure, I beg you in the name of God, if for any reason you want to change the medication or anything, go back to your doctor, make a review, unless you not trust your doctor. But no allow anybody just see you, the person just catch you and tell you that the BP don't low, stop the medicine. The person dey there when they start you the medication, no. So as you dey go listen to people up and down, dey take opinion. Na so dey go dey give you this kind information. Your brain go come dey turn, dey turn, dey turn. You come confuse. Always go and speak with the doctor wey start. Tell am say, I hear say if the BP be like this, say I go get problem. Im go look your blood pressure. E go look you, e go check you. Say no, you don't have it. You are fine. Oh, this medicine, can we reduce the dose? It go tell you, say, oh yeah, oh, never reduce am. After 2 months, come back. But you go just wake up by your own self because you follow one influencer on internet. And then because you like your fave, anything he tell you, you go just run do am. You can't go buy yourself throway. Please don't do that. Now the last question, because of time, we really do have to go. This question, Dr. Israel, the person say, wait, make I e dey on TikTok. I want check am. He says, oh my god, wait. Okay, he says, does the medicine, that medicine for high blood pressure, does the medication destroy organs? You see these comments, this question, na some people dey spread am for internet, say make you no take medicine, say e go damage your organ. Now, before any medication is produced, that medicine don pass so many process, so many years of study. And during all the study, as long as you take the medication as prescribed for you, as advised by your doctor, e no go destroy any organ for your body. The only problem be say some patients can lie. If doctor tell them, take one tablet of this calcium channel blocker, take only one tablet. Some go take that medicine plus some other things wey dem no need. Those things fit come dey damage their system. Dem no go know, come talk say na the medicine. So as long as you follow the advice given to you by your doctor, your organs are safe. But if you no take medicine and your BP high, your organs, your eye, your heart, your kidney, your brain fit get problem. You dey hear me so? Dr. Israel, we are out of time. We are out of time. Any final words?
Okay, what I would say is that this topic dey very interesting, and I can see the vibe in this topic, and many I dey see a lot of questions, a lot of questions. I'm really sorry say we not fit answer most of this question. So the doctors wey dey GOPD, yes, they can start the management of your high blood pressure, but then go come finally refer you to see an either a cardiologist, depend on the issues that follows the blood pressure. It can be a cardiologist, can be a nephrologist, can be an endocrinologist, any of them. But cardiologist is majorly the persons that they may refer you to. But they will always be the first person to start your medication and all that, and even they manage you when nothing serious they happen. Also, get wetin doctor when I see for them say they'll tell them say their blood pressure does low, make dem stop the medication. The funny thing is that some persons before they go check that BP, they don take their medication. Because they take their medication finish, they come go check the BP. What are you expecting? The BP suppose come down. Then they'll come think say they're not supposed to take the medication again. Please, for those persons wey get high blood pressure, when your doctor start you on medication, I wan use this medium take appeal to you guys. Continue on your medication unless your doctor says otherwise. Unless your doctor says otherwise. Not unless the nurse wey dey check am for you for house, or the pharmacist wey dey check am for you for house, or the chemist man wey dey check am for you for house says otherwise. Unless your doctor says otherwise. Because high blood pressure e no dey tell person when e wan handle the person, and we no want make e handle any of us for here. Know this and know peace.
Thank you so much, Dr. Israel. For you where they watch us, this program now every Sunday by 8 p.m. West African time. We have been here for more than 5 years. So no be today we start. As a matter of fact, we no be babies in the medical profession. So we dey here to give you information we go help you. We no dey here for you to come dey consult us privately. We no dey find patients. Go to hospital. We no dey give you number because we are not here looking for you to give us and call us. No. Take the information, go to your doctor. Dey careful. No allow somebody give you something wey say go come damage your body. You hear me so? And then one of our doctors here, our senior oga talk say, don't wait for high blood pressure to give you sign. Go to the hospital and check it. E clear abi e no clear? Next Sunday, we go dey here again by the grace of God, and we go get another topic. By next Sunday, we go still teach you. No come late so that we go fit attend to all your questions. If you know say you never follow, click on the follow button, share this video, subscribe if you never subscribe, and I can always tell you, good life now waiting. Good life. Oh yeah, tell me, good life na sense. So take care and have a wonderful night. Bye bye.
Bye bye.